with Dr. Travers. She is a PhD trained nurse with a master's in health sciences. She is my amazing friend from fellowship. We both were at Yale in the National Clinician Scholar Program together. And so Jasmine's field of interest within nursing is geriatrics, and she'll share all about that. She went to Adelphi University and Stony Brook and Columbia University, and now she is at NYU. Her hobbies are salsa dancing, running, and reading. And a fun fact about her is actually she ruptured her Achilles tendon playing basketball. So she can also share a little bit more about that as we go. But we appreciate you joining us today, Dr. Travers. Nice to see you again. And I hope the students are engaged, and I will turn it over to you.
Good to see you as well, Dr. Weiss. I'm excited to be here, y'all. So hopefully you all are ready to be interactive, be engaged, and just learn more about nursing and the care of older adults or geriatrics. I'll go ahead and share my screen with you all.
And now she is at NYU. Her hobbies are salsa dancing, running, and reading. And a fun fact about her is actually she ruptured her Achilles tendon playing basketball. So she can also share a little bit more about that as we go. But we appreciate you joining us today, Dr. Travers. Nice to see you again. And I hope the students are engaged, and I will turn it over to you.
Good to see you as well, Dr. Weiss. I'm excited to be here, y'all. So hopefully you all are ready to be interactive, be engaged, and just learn more about nursing and the care of older adults or geriatrics. I'll go ahead and share my screen with you all. All righty. All right, so for our session objectives today, this session, you're gonna get a greater understanding of the nursing profession with a specific focus on the fields of geriatrics, aging, so get excited. And then we're gonna learn what a clinical position in geriatrics looks like and why placing attention on the needs of aging adults is important. And just going back to my fun fact, I ruptured my Achilles tendon in 2018 after running a half marathon. I had tweaked my Achilles while training. I was able to run the half marathon, and then a few weeks later after that was playing basketball pickup at the basketball court outside and ended up rupturing it. So that's just a little bit more about that fun fact. I played collegiate basketball. All right, let's keep going. So, icebreaker. What has been the #1 trusted profession?
Let's see, drop it in the chat, drop it in the chat.
Go ahead and drop it in the chat.
Got some good answers here.
All righty, y'all are too good. Yes, B, nurses. And I think everyone in the chat said nurses. Any thoughts about why nurses?
Let's see what we got. You guys feel free to unmute as well.
Is it because like there's always someone you can help out?
Yeah, it's during that help, right? But it's thinking about you, where you are at in that stage of needing help, right? You're at the most vulnerable point in your life, right? Where you need care, you need help. And this person is seeing almost everything about you. Not just seeing this vulnerable part, but say if you need to be washed up or you need help changing, this person's really spending some intimate time with you, and you have to trust someone like that, right? To be so close and all up in everything that's going on. Some things that people have in the chat, they have been around for so long. Nursing has been around for a long time too. Patients are left in the care of nurses more than doctors. That is true too. So while doctors, are very much involved in your case, the people that are there for you for the entirety of the day is going to be the nurse in most cases. and they need to know what they're doing. You need to trust that they're going to provide the best care for you. And they do spend a significant amount of time with the patients and provide a lot of support. So great. Let's see. All right. Another fun fact. So there's been 1 year that nursing has not been the #1 trusted profession since the Gallup Review has been taking this survey amongst the country. So 1 year. What year?
Ooh, got a mixed bag coming in. A's, B's, C's, D's.
Okay. All right. So I don't want to show you all the answer yet. I want to hear a little bit why you all chose the answers that you chose. So someone said something already in the chat about 2020, but those who chose
Can you hear me? Can you hear me?
Jordan, I can hear you. What did you do,
so
Jordan?
The reason I chose A is because I believe it's when like COVID started getting big and people didn't really trust doctors and they felt like they were going to probably like do, instead of trying to help them, actually like not, I don't know, something like that.
That's a good point. But you said doctors though, Jordan. So
I'm sorry.
Nurses in there too?
Yeah. It's kind of, I'm thinking both doctors and nurses, to be honest. Like, I don't think people trust it, like healthcare in general.
That's good. That's good. Thank you, Jordan, for sharing. Anyone chose B? What about C?
Let's see. Martrice chose B. What'd you think, Martrice?
I really chose it just because I feel like 2020, I would say that they would trust the doctors and nurses to figure out what was wrong with them. And then like I just feel like C wasn't the answer or D, so I just chose B.
Okay, process of elimination. What about C? Anyone chose C?
I chose C because it was kind of one of the only years that didn't have something major going on. I was only 2 years old in 2006, but I don't think there was any like global thing or any important national thing happening in 2006 to where nurses weren't needed. But like, as people have mentioned before, there was COVID in 2020, 9/11 in 2001. And I know there's a lot of like kids that were born from like 2003 to 2007. So that's why I'm thinking nurses were trusted and needed the most in 2006 as well. So 2014 was kind of chosen as like an outlier.
I like your reasoning, Stella. Okay, let's hear the D's. I'm not going to give anything away yet.
I think I saw Kevin. Kevin, can you tell us why you chose D? Or Jalen?
Yeah, can you hear me?
Yes, we can hear you.
Okay, so I chose D because of 9/11, and I thought there could have been increased trust in like firefighters, police officers, or other like first responders. So that's why I chose D.
That's good thoughts. Oh.
Ding, 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 ding. So, Jalen, you're correct. 2001 is the answer, and for the reasons that you mentioned. So, firefighters, that the first responders. So that was huge. So 2001, that's when 9/11 happened. It sounds like some of you are, or many of you all weren't born at that time. So, so you may or may not have known about 2000 or 9/11. But yes, first responders and particularly firefighters were very much regarded during that time. But I do still appreciate the reasoning when thinking about nurses still being important to provide care for those patients. And then even in 2020, I like the thought, just kind of thinking about when possibly nursing wasn't the most trusted profession. One of the things that I know and I think about is kind of the vaccine when that was coming out, and a lot of healthcare professionals saying that they weren't going to take the vaccine, and that being a bit problematic. So I could see, 2020 possibly not being a year when nurses were voted #1, but they've been voted #1 since the 1970s. I appreciate you all's thoughts and the ways that you all kind of broke that down. All right, so we talked about why nurses have been the #1 trusted profession, and I just want to share with you all a video that really gets at what a day of a nurse looks like. So I'll go ahead and play and just really take into the lyrics that are shared in this song so that we can dive into them a little bit more after. All right, I'm gonna play. And this is from a doctor who is singing this song.
She can cure with a smile, she can heal with her hands, but she can ruin your high with .2 of Narcan. And she only sips Snapple where Jaco can see. She's wise like a doc, but she's always a nurse to me. She can lead you to vax, she can calm you and teach you. She can ask for your med list, but she'll never believe you. And she's got a side hustle, loan interest ain't free. Steal your pen like a thief, but she's always a nurse to me. Oh, she can care for herself on the staff in 4 months. She's again over time. Oh, and she never takes breaks, and she never pees once. She just changes bed night, and his patients want more than the Garden of Eden. And they still call him Doc when he said he's Nurse Steven. Still he brings out the best a caregiver can be. Blame it all on yourself, a nurse ain't always a woman, you see. Oh, they take care of you well, despite 1 nurse to 9, their license on the line. Oh, and she never gives out, and he never calls in. They just coded bed night. She is caring and kind when you're suddenly cruel. He can smile and stay calm while you act like a tool. And unlike that Gwyneth, she's earned her degree. And you love what you do, although praises are few, yet you're always a hero to me.
All right.
Bravo.
All right, so that's, I think his name is Z, he calls himself Z-Dog. He's a doctor, and he has a number of videos that you can look at YouTube related to healthcare professions. All right, so what stood out to you about nursing from those lyrics? And some of which you all kind of shared already, but what stood out to you?
I like the part in the song where he said that she, or well, a nurse in general, loves their job regardless of like the praise that they get or the amount of praise that they get. So that really stood out because, you know, some people just do things because they want praise for it, but regardless of getting it, they still, you know, love what they're doing. And that's like true passion.
Definitely, Asmita. And I think that's another one of the things that kind of make nurses who they are, because it's not an easy job, and you're not recognized in many cases, but it's the heart of the work that you're doing and the care that you have when providing that care to others. Just Desari, I like that you put out that nurses are not always women, which is exactly the case. And can be a problem where we assume, the nurses are always the women and the men are always the doctors. And I see, Sefi said the same thing, that distinction between nurses and doctors without throwing shade to either profession, right? Nurses don't have time to break and are always working overtime. Yes, Vivian. So I remember sometimes working an entire 12-hour shift and not being able to go to the bathroom. But at the same time, just like what was mentioned by Asmita, like, we go in and we do what we do and we don't necessarily complain. And the part where he mentions the Garden of Eden, to me, it symbolized a form of beginning and creating for others. Wow. As in taking care of a patient more than, let's say, a doctor would. That's really good, Elizabeth. The way he talked about how nurses don't always have breaks or time to themselves and how they tend to be constantly moving without eating or even going to the bathroom. Yes, it's always something to be doing, always something to be thinking about when it comes to your patients, right? All right, anything else?
He made it very clear that nurses are very reliable. And like you were saying earlier, he made it clear that y'all might not get that many breaks, but y'all always make sure to put the patient before yourselves.
Definitely. Exactly. It's just always so much going on. And we haven't talked really so much about the practical stuff that nurses do from hour to hour, but all of the kind of emotional stuff that doesn't necessarily, and psychosocial stuff that doesn't get quantified. Let's see, a big part that stood out to me is the constant mention of how nurses always work and help everyone no matter what. Also the taking away the generalization that nurses are only women. Great. He also talks about when people suddenly become cruel, they stay calm and nice. I appreciate you seeing that, Christia. I think I have been able to better respond to friends and people that I don't even know because of my experiences in the nursing profession, right? Recognizing that it's not the person, it's not, well, in my head, I say it's not the person, it's what they're going through, which is making them behave the ways that they are, right? Because they are in a time when it's difficult, it's challenging, they're sick, they probably experience trauma, whatever is going on, and that's what they're responding to. So in that moment, just staying calm and staying, pleasant is going to only help the situation, if anything, or at least not worsen the situation. And that's the same thing with family members too. Nurses work hard and connect with their patients, most definitely. One of the things, Natalie, thanks for bringing that up. I always felt like every patient that I had, like I was able to make a connection with them, like they were meant for me. In a way, and it's so crazy, but that's really how I feel, that the patients were designed for, well, not necessarily designed, but they were, especially assigned to me, that they have a side hustle, loan interest ain't free. That's good, Angie. Sounds to me because my older sister is a nurse and also she has a side hustle. Yeah, loan interest isn't free, but I'll tell you one thing for free, is that nursing and other healthcare professions, I would implore you, if that's a route that you will indeed go towards, look into loan repayment programs and loan deferment programs, because there are programs for nurses and other healthcare professionals that will help with those loans that you have, and hospitals will as well. All right, thank you all. This has been great. All right, so just kind of thinking about some primary responsibilities. They perform exams and health histories before making critical decisions. So they're going through that full assessment of the patient to understand a little bit more about what are the irregularities that are happening. And they do that multiple times a day to see, if anything has changed from when last time they assessed the patient so that they can be able to respond to those changes. They administer medications and other personalized interventions. So in the video talked about Narcan for maybe a patient that came in with substance abuse, but antibiotics, a number of medications that nurses not only just administer, but they need to know, what they're administering them for, and then also know the pharmacology behind those medications so that they can ensure that indeed the patient should be giving that medication. Although, the physician or other healthcare provider puts the orders in, it's still the nurse who has to make sure that this order is correct as they're administering it, because they are one of the checks to make sure that we don't have medical errors. And then there's a number of personalized interventions that nurses perform. So wound changes, catheter insertions, nasal gastric tube placements, IVs, blood draws, a number of things that nurses do that are interesting when it comes to those types of skills. And then they provide health promotion, counseling, and education, making sure that when you leave the hospital, for example, or you leave the clinic or wherever you're going next, that you understand, or not even just when you leave, but during that time, you understand what's going on with you and how you can kind of take the information that you need to apply it in the community setting, in your home setting, so that you can live a healthier life.
Have you heard her? Have you heard her?
Everybody's muted.
Culture in the boys.
Any questions before we go into my story?
Let's see. If everybody can make sure you're muted.
All of them black.
Let's see. Okay, found it. Emily, can you mute your screen? Let's see.
Oh, code or bed 9. That's a good question, Natalie. So a code is when a patient, when their heart stopped beating.
Mm-hmm.
So at that time, you say the patient coded. That's a common, but maybe in the hospital, it's called code blue. And we say, oh, the patient coded. So then, then you start to perform resuscitation on that patient. You do compressions and such. Bed 9 was just refer.
He just made that up.
Yeah, exactly. That's nothing. They're probably just like, oh, because we'll say, oh, the patient, I need to go see patient in bed 1 or see patient in bed 5, which that's something that we shouldn't be doing. And we've kind of gotten scolded about that in the past, because it's like, patient is not bed 9. They are patient Travers or patient Wise, These patients have names. They're not beds. That's the room number that they're in. Sorry. Just to make sure I'm being as explicit as possible.
That's a great question, Khadijah. We'll save that, but table that. Do you get to choose your patients, or do they get assigned to you? We'll happen to that during the Q&A.
Okay.
All right. So, Dr. Travers, we would love to hear more about your story. So with that, we'll jump to the next slide and get a sense of who you are.
Okay. So yeah, I'll answer your question at the end, Khadijah. Sounds like that's what you want, Dr. Weiss?
Yeah, just so we can make sure we get to all the fun stuff first.
Okay, sure.
All right. So you've already kind of alluded to this, but what is geriatrics and what inspired you to go into the field of geriatrics?
Sure. So geriatrics is pretty much the opposite of pediatrics. And oftentimes we are so familiar with pediatrics, and probably because we've gone through the whole idea of pediatrics. We probably have a pediatrician that provides care for us. And we've never seen a geriatrician because we haven't reached that.
We haven't gotten there yet.
But geriatrics is the care of older adults. And so that's what geriatrics is. And it's particular attention to the syndromes and the health illnesses and different just health experiences that those who are older adults experience. Just like when for pediatrics, there's certain experiences with like growth and development that you all are going through that the pediatrician is going to be an expert in. It's the same thing with geriatrics, just the opposite end. Or very similar. But what inspired me to go into this field? So when I started as a nurse, it was back in 2009. And it sounds like at least you all were born then. You probably don't remember. We were going through a recession. I think that started in 2007, 2008, around that time. And when I was graduating, everyone was saying, oh no, we're not hiring. I was at a career fair. They were saying, we're not hiring, but we'll take your CV. So I was like, you know what? And this was in New York. And I'm originally from Maryland. And I was like, you know what? I'm just going to wait and take my NCLEX licensure exam. And I'll talk about that a little bit more later. And I'll just go home to Maryland and apply for jobs there. And there was one place, Stony Brook Hospital over in New York, but on Long Island. They contacted me before I even graduated, and they invited me in for an interview. And I said, well, I never even put an application in. And Stony Brook, they were hiring new grads, but the thing was they wanted, someone said they're from Long Island. That's exciting. They wanted an application, they wanted an essay, they wanted all these recommendation letters. And I was just like, this is too much. So when they contacted me, I said, I didn't fill out any of those things that you all wanted. And they were like, we know, just come in for an interview. We want to meet you. So I came in for the interview. And, they told me that they were going to conditionally hire me. They wanted me to submit all of the application stuff and the letters of recommendation. But they told me I'm an Adelphi grad. They said they love Adelphi nurses. And they were going to they were hiring me before I even got my NCLEX. So they do that at Stony Brook. They'll allow you to work on permit. So I started Stony Brook as a residency for nurses, which is phenomenal. And definitely I recommend those types of experiences for anyone too. Being able to do residencies and fellowships when you just start are really critical and beneficial. So I did that, and I started off on a surgical step down unit. And that's where they assigned me. So I didn't choose that. When you come into nursing, like your first year, it's difficult to kind of get into those specialty places, especially places that you just want to go in as part for like your choice. But that's where they placed me. And when they had overtime available in a medical step down unit, and I signed up for that overtime, and that medical step down unit was in collaboration with the ICU unit there, medical ICU unit. So I was just talking to the manager there, and I was telling her that, I really liked the unit and I would love to apply there one day. And the thing with ICU, a lot of times new nurses, you have to be about a year or 2 years in to get those types of positions. And they told me to go ahead and apply, and I did. And I started working on the medical intensive care unit under a year in, and I absolutely loved it. So that population is a very sick and critical population, but it's an older adult population. I felt like I interacted very well with the older adults and just connected with them. Like I just loved it, and I still love it. Like I love the medical ICU. So yeah, so step down units are where, thanks, Dr. Weiss. where patients go when they're not quite as sick as ICU patients, but can't be on the general floors. Yeah. So just to kind of give you some comparison, the general floors, and Z-Dog alluded to this a little bit with regards to the patients. He said that some nurses can have to take care of 9 patients at times. But yes, the medical surgical floor, you tend to have a lot more patients that you care for, but they're not as sick, so they don't need as much, one-on-one attention. Then, so those can be, like, on average, a good number is 5 to 6 patients, but sometimes you can have anywhere 7 to 8 plus patients. Step down units, they're a little bit more sicker than your medical floor, your med surge, but you're going to have about 4 patients, and then ICU about 2 patients.
Mm-hmm. And part of that's because the care they need, right, takes so much more work and time from you all's perspective, from the nurses, to be able to take care of an ICU patient. So that's
exactly
fewer.
Exactly. And I loved that, just like intimate time. I felt like I was learning so much by being able to have 2 patients only, and also kind of experience rounds. So when the physicians and other healthcare providers and respiratory therapists and everybody would go on rounds, and nurses, we would be a part of those rounds as well. And just really talking about how do we improve care for this older adult who is very sick, was just mind-blowing to me. So I learned so much, and was able to just do so much. Like, all that coding was very much a part of, like, my everyday life as an ICU nurse, but it's very exhilarating.
Mm-hmm. All right. Let's see, what challenges did you face along this journey? So you kind of alluded to it a little bit about, your journey to becoming a geriatric nurse, but what challenges would you say you faced?
Yeah, so definitely, I think that was one of the challenges with regards to thinking that I may not get a job right away, which I did, which is phenomenal. And then I guess it's not a challenge, but what was difficult for me was the NCLEX exam. The NCLEX exam is just pretty particular, where it ended up being one of the hardest things I would say that I had to do in my life with regards to, like, testing. And there's like 265 questions that you can have, but the algorithm works as such. So if you're doing really well, it will stop at 75 questions. And if you're doing really poorly, it will stop at 75 questions. So I was taking the test, and it stopped at 75 questions. And I said, there's no way I was doing really well at all. And felt like I most definitely failed it. And what was even worse than feeling that I failed it was that I was like, this test is so hard, I wouldn't even know how to study for it to, pass it the second time. So that's how bad it was. And the thing is, it's not the same test that you're going to come back into. It's going to be a whole different test that they're going to set you up with. But I received my reports 2 days later, and I did pass. So that was probably one of, like, my most joyous moments in my life.
Fantastic. So takeaway point there is, these tests are no joke, guys. I can imagine the kind of the panic, right? You're going through the questions like, oh goodness, how am I doing? I also remember that feeling. So it's totally normal, guys, when you're studying for your health professional school exams and getting prepared, and during the test, to feel anxious and nervous. And for Dr. Travers, it worked out just fine.
Yeah. And I think on top of that, I think also why I was so stressed is and studying, sleeping, this test, like, as studying. So I'm like, that's a lot, and then, just kind of thinking about, where do you go from here?
So okay. Thank you for sharing that challenge with us. So you mentioned one of the most joyous days. What are some other joys of your job being a geriatric nurse?
I would say and I was kind of alluding to this earlier, was the connections that you make with the patients. they're just such great stories to be able to leave the work and just feeling like you made a difference in someone's life. And that's one of the things that I really appreciate about nursing, is that feeling like I made a difference in someone's life. One thing, before I actually went into nursing as like an independent nurse, when I was a student at Adelphi, I did my internship in the OR. And as a student, you don't do your internship in the OR unless you know you want to be in the OR. And I thought I wanted to be in the OR. But then when doing my clinical hours in the operating room, all we did, for the most part, was make sure that the patient's consent was signed, make sure the timeout was done and everyone stopped, and then make sure that all of the equipment and tools were not left in the patient. And then the patient would go off to recovery. And I never had that interaction and that engagement with the patient. And I didn't feel like I made a difference in the patient's life. Where, I mean, in actuality, you can see some of the connections where you probably do make a difference. And of course you do. But I needed that, like, more that contact with the patient. So I would say that's really some of the joys of my job. Just being able to kind of see the patient, get better, or even just feel like I had a role in that patient's care.
Absolutely. And then for you guys, a timeout is basically before a major procedure. You have to make sure you have the right patient. You have to know what type of procedure you're supposed to be doing on the patient, the location of the procedure. There have been times where there have been errors, right, in medicine, where they were supposed to do a right leg amputation and they did a left leg amputation, right? So timeouts are really critical in our, as Dr. Travis is alluding to, it's not to be taken lightly when that timeout takes place. Hence why it's literally when everything stops and everybody focuses. So, we're glad you were doing those too as a trainee.
Yes, they're just as important. So let me not minimize anyone's role, but I wanted more connection.
Absolutely.
When the patient was awake.
Absolutely. All right. So what are characteristics of a successful geriatric nurse or geriatric nurses?
Yeah. So I think it goes along with a lot of the characteristics of nursing in general, and a lot of you all kind of shared some of those characteristics. So kind of thinking about empathy, really being able to, put yourself in the patient's shoes that you're caring for, and see what they're probably seeing through their eyes as well. And that really kind of changes the way that you provide care. And even more so, how we think about that is being able to provide care the way that you would want that care delivered to yourself or your family members. So that being, at the root of everything that you're doing, so that you can actually really, continuously reflect on, am I providing the best care as possible? And then one of another characteristic that I would say is important is this reflexivity. So what that means is being able to kind of identify what our biases are and bracket those. So kind of put that behind us, because we cannot allow our biases to drive the ways that we provide care. And when we think about biases, we might think about, biases between like someone who has a specific racial ethnic makeup, or even, gender, sexual orientation. But there's a number of other biases that come out in the healthcare profession. So for example, myself, when I worked on surgical step down, I would have a lot of trauma patients coming in. I would have, for example, a patient that would come in. He had raped a young child and then got beat up from the communities, people in the neighborhood, and then now was in the hospital because he had gotten so brutally beaten up, but in the hospital under under police surveillance. So he was locked up to the bed. So that would be my patient that I cared for. And oftentimes people would come by, other healthcare professionals, saying different things about them, because of course that is just horrific, right? But to still be able to put behind all of those things, that feelings and emotions that we have behind that, and still provide the care that patient needs, is something that is an important characteristic and can be very challenging.
So just having that empathy for the care that's needed, and then being able to put behind the circumstances for why patients were there.
Exactly. And especially, with geriatric nursing, sometimes there's this, ageism as well, where we might think that older adults don't need, care as much as a younger adult needs, and things like that. Being able to put that aside and provide the same kind of care the care that person needs, despite who they are.
Absolutely.